Our hearts, the engines of our bodies, tirelessly pump blood, delivering oxygen and nutrients to every cell. This continuous flow is essential for our survival, ensuring that every organ and tissue functions optimally. The heart's rhythmic beats are a testament to its relentless work, day in and day out. But sometimes this vital flow is obstructed. Plaque, a combination of fat, cholesterol and other substances, can build up in the arteries, leading to a condition known as atherosclerosis. This buildup narrows the arteries, making it difficult for blood to pass through. Imagine a traffic jam inside your arteries, those crucial highways for blood. Just as a traffic jam can bring a city to a standstill, a blockage in your arteries can have severe consequences for your health, potentially leading to chest pain, heart attacks, or even strokes. This is where angioplasty comes in, a minimally invasive procedure offering a second chance at life. By using a small balloon to widen the narrowed artery, angioplasty helps restore normal blood flow, alleviating symptoms and reducing the risk of severe heart conditions. Angioplasty is like a roto-rooter for your arteries, clearing blockages and restoring healthy blood flow. The procedure involves threading a thin tube through a blood vessel to the affected artery, where a balloon is then inflated to push the plaque against the artery walls. In this essay, we will delve into the world of angioplasty, understanding its importance, procedure, benefits, and risks. We'll explore how this technique has evolved over the years, and the advancements that have made it safer and more effective. Angioplasty has revolutionized heart care, providing a lifeline for millions worldwide. It has become a cornerstone in the treatment of coronary artery disease, significantly improving the quality of life for many patients. By opening up narrowed or blocked arteries, angioplasty relieves chest pain, reduces the risk of heart attacks, and improves overall heart health. The procedure's success rate and the relatively quick recovery time make it a preferred choice for many. Join me as we explore this life-saving procedure. We'll hear from experts, see real-life examples, and understand why angioplasty is a beacon of hope for those battling heart disease. Our arteries, the intricate network of blood vessels, play a crucial role in delivering oxygen-rich blood throughout our body. These vessels are essential for maintaining our overall health and well-being, ensuring that every organ and tissue receives the nutrients and oxygen they need to function properly. However, over time these arteries can become narrowed or blocked, a condition known as atherosclerosis. This condition is often silent, progressing without noticeable symptoms until it becomes severe. Imagine plaque, a sticky substance, gradually building up inside the artery walls, like grease clogging a drain pipe. This plaque is composed of fat, cholesterol, calcium, and other substances found in the blood. This buildup restricts blood flow, starving the heart of essential oxygen. When the heart doesn't get enough oxygen, it can't function properly, leading to chest pain, shortness of breath, and other serious health issues. Several factors contribute to this arterial buildup. These include lifestyle choices, genetic predispositions, and other health conditions. High cholesterol, smoking, diabetes, and poor diet are significant contributors. Each of these factors can damage the inner lining of the arteries, making it easier for plaque to accumulate. High blood pressure also plays a role in damaging our artery walls. When the pressure of the blood flow is consistently high, it can weaken the arteries, making them more susceptible to plaque buildup. As plaque accumulates, it hardens, forming a blockage that can have serious consequences. This hardened plaque narrows the arteries, reducing the flow of oxygen-rich blood to vital organs. When blood flow to the heart muscle is completely obstructed, a heart attack occurs, a life-threatening event. Immediate medical attention is crucial to restore blood flow and minimize damage to the heart muscle. Angioplasty, also known as percutaneous coronary intervention, PCI, is a minimally invasive procedure that opens up blocked or narrowed coronary arteries. Unlike open heart surgery, angioplasty doesn't involve major incisions. Instead, it utilizes a catheter, a thin, flexible tube, to access the heart through an artery in the groin or arm. The journey begins with the insertion of the catheter into the artery. Guided by X-ray imaging, the catheter is carefully threaded through the bloodstream towards the blocked artery in the heart. Once in position, a tiny balloon at the tip of the catheter is inflated, compressing the plaque against the artery walls and restoring blood flow. Let's break down the angioplasty procedure into easy-to-understand steps. This minimally invasive procedure is designed to open up blocked or narrowed arteries, improving blood flow to the heart muscle and alleviating symptoms like chest pain or shortness of breath. First, preparation. The patient is given local anesthesia to numb the insertion site. This ensures that the patient remains comfortable throughout the procedure. The anesthesia is typically administered in the arm or groin, depending on where the catheter will be inserted. A small incision is made in the groin or arm, and the catheter is inserted into the artery. The catheter is a thin, flexible tube that will be guided through the blood vessels to the site of the blockage. This step is crucial as it sets the stage for the rest of the procedure. Next, catheterization. Using X-ray guidance, the cardiologist carefully advances the catheter through the bloodstream to the blocked artery in the heart. The X-ray imaging allows the medical team to see the exact location of the catheter and navigate it precisely to the area that needs treatment. A contrast dye injected through the catheter allows the doctor to visualize the blockage on the X-ray screen. This dye makes the blood vessels visible on the X-ray, highlighting any areas of narrowing or blockage that need to be addressed. Then, balloon angioplasty. Once the blockage is reached, a tiny balloon at the tip of the catheter is inflated. The inflation of the balloon compresses the plaque against the artery walls, which helps to widen the narrowed passage. This compresses the plaque against the artery walls, widening the narrowed passage and restoring blood flow. The improved blood flow can significantly reduce symptoms and improve the patient's quality of life. Finally, stenting. In many cases, a stent, a small expandable metal mesh tube, is permanently implanted in the artery to help keep it open and prevent future blockages. The stent is expanded once in place, providing a scaffold that supports the artery walls. The stent acts like a scaffold supporting the artery walls. This helps to ensure that the artery remains open, reducing the risk of future blockages and promoting better long-term outcomes for the patient. The combination of balloon angioplasty and stenting is a powerful approach to treating coronary artery disease. Section 5. A new lease on life. The benefits of angioplasty. Angioplasty offers numerous benefits for individuals with blocked arteries. By restoring blood flow to the heart muscle, angioplasty relieves chest pain, also known as angina. Angina, often described as a tightness or pressure in the chest, is a warning sign of reduced blood flow to the heart. Angioplasty effectively addresses this issue. Moreover, angioplasty significantly reduces the risk of future heart attacks. By opening up blocked arteries, angioplasty prevents the formation of blood clots that can lead to heart attacks. This life-saving procedure improves overall heart health, allowing individuals to live longer, healthier lives. Section 6. Weighing the risks, potential complications. While angioplasty is generally safe, it's essential to be aware of potential risks and complications. As with any medical procedure, there's a slight chance of bleeding or infection at the catheter insertion site. In rare cases, the artery may be damaged during the procedure. Another potential risk is restenosis, where the treated artery narrows again over time. This can occur due to scar tissue formation or the recurrence of plaque buildup. However, the use of drug-eluting stents, which release medication to prevent restenosis, has significantly reduced this risk. Section 7. Angioplasty by the numbers, success stories and statistics. Angioplasty boasts a high success rate, with over 90% of procedures successfully opening up blocked arteries. Millions of people worldwide have benefited from this life-saving procedure, experiencing relief from chest pain, reduced risk of heart attacks, and improved quality of life. Studies have shown that angioplasty significantly reduces the risk of death from heart disease. Patients who undergo angioplasty often experience a dramatic improvement in their symptoms, allowing them to return to their normal activities sooner. Section 8. Beyond angioplasty, maintaining heart health. While angioplasty is an effective treatment for blocked arteries, it's crucial to remember that it's not a cure for heart disease. Maintaining heart health requires a lifelong commitment to healthy lifestyle choices. Adopting a heart-healthy diet, rich in fruits, vegetables, and whole grains, is essential. Regular exercise, at least 30 minutes most days of the week, helps strengthen the heart and improve circulation. Quitting smoking, managing stress, and controlling blood pressure and cholesterol levels are also crucial for long-term heart health. Section 9. A brighter future. The enduring impact of angioplasty. Angioplasty has revolutionized the treatment of heart disease, offering a minimally invasive and highly effective solution for blocked arteries. This life-saving procedure has provided a second chance for millions of individuals worldwide, relieving chest pain, reducing the risk of heart attacks, and improving overall heart health. As technology continues to advance, we can expect even more innovative and less invasive approaches to angioplasty, further improving patient outcomes and quality of life. Angioplasty stands as a testament to the power of medical innovation and its profound impact on human health.